Good morning again. Welcome along to March. March is all about exercise for arthritis. This particular webinar is exercise for arthritis. We're looking at joint specific exercises. And in this session, it's for the spine and the upper limb. The upper limb really should just be changed to shoulder, because what I've done, if you hadn't come along to this presentation last year, I included the hand, and I was really cutting it fine with time. So if you're expecting the hand, don't. There is another one on the 21st, Tuesday the 21st, 7:30. I will be dedicating a webinar to exercises for hand arthritis and for the foot. Okay, so this is for spine and this is for shoulder. Again, always good to mention that this presentation contains general information and advice only, and always consult your doctor or healthcare provider to obtain individual medical and/or treatment advice. Okay. Like I mentioned, we're going to be looking at the Get Moving Plus resource, focusing on the upper limb, spine, and shoulder. Before we look at those, we will just be recapping why physical activity and exercise is important for people with arthritis. And as we look at the spine and the shoulder, I will briefly run through some anatomy and the function of a particular joint. And then we'll have a look at the exercises that promote mobility, stretches, and strength that are all part and parcel of the Get Moving Plus resource. So this presentation, or the next three presentations, the one today, the one tonight, and the one next Tuesday, are just about creating awareness of this particular resource. So they may or may not be very long. They may not take an hour or so. They may only take half an hour, 40 minutes to go through, but I'm more than happy to answer any questions, or if you'd like to do them with me, you're more than welcome to. But it's just about creating an awareness of this resource that we have on our website, that it's free for everybody to use. And for majority of the exercises, there are videos. In fact, there are videos for all of them, I think, except for the hand. So for when you look at the Get Moving Plus for the spine and the shoulder, there are actual YouTube videos to show you how to do these. And lastly, I haven't included every single exercise that are from each of these booklets that we have online. Otherwise, we may be here all day. I've just selected a few to go through. Okay, so the importance of movement and exercise. And we've spoken about this, but well, I've spoken about this many times before, and you may very well know and understand the importance of exercise, but it's extremely important for everybody to exercise, to bear weight, to move, and to reduce our sedentary activities. Because if we want to be looking after our cartilage, this is what we must prioritize. Remember that our cartilage is like a sponge in that it needs to, for nutrition, to soak up and absorb and use the synovial fluid within our joints. Okay, so we have two long bones that come together and form a joint. There's a joint space between the two bones, and that's where the synovial fluid sits. And on the ends of those bones is cartilage covering, okay, for smooth movement, shock absorption, etc. And what keeps it healthy is the movement of synovial fluid in and out of the cartilage, okay? And like I mentioned, the cartilage soaks up synovial fluid like a sponge, but it also needs to be pumped in and out, okay? In and out. And to do that, or how that happens, is through movement. So loading through the joints. So every time we load the joint, particularly a weight-bearing joint, like a knee or a hip, or a spine, there is pressure, there is force going through that joint, which squeezes out the synovial fluid. And then when that eases, when that pressure or that weight eases, then the synovial fluid can be soaked back in. And then this is just this general, this is just this continual pump movement or mechanism. So that's why I've got SpongeBob SquarePants there. Synovial pump mechanism. And I always go with the saying, motion is lotion, and that might be ringing some bells for you there. So motion is lotion. Not only that, and because of that, we can maintain joint range of motion and flexibility. So basically, we could use that old saying, if you don't use it, you lose it. That's for strength, so muscular strength. That's for range of motion as well. And I can prove that because when you sit down for a long period of time and you go to get up, you often feel very stiff. And for the first maybe couple of steps that you take, maybe you can't like straighten out all the way, or your knee feels a bit stiff and it won't extend all the way. So the more we put our joints and our body through range of motion, or what range of motion we have left, the more likely we'll keep it, and it will be easier to move through. Exercise maintains strength of muscle, which is really, really important as we age, because that often actually declines over time, our strength in our muscles and in our bones. I mentioned reduces the feeling of stiffness and pain. And again, can help reduce or slow the progression of arthritis, the disease in which we're talking about today. So I hope that was just a little bit of a recap for you. If you wanted to know a little bit more about that, there's a recording from the first webinar in March last week. That's now available on our website, and I talk about those in a little bit more detail. But right now we're going to move on to the spine anatomy and function. So we're going to look at the spine. And like I mentioned, the first thing we'll do is look at the anatomy, and it's only going to be very in brief. But I think it's important to note, because I think when we understand how a joint moves or why a joint moves, then we can, then we understand how and then why we move it with exercise, okay? So we look at its limitations and its functions. So it's important to note, because we know that arthritis can affect all joints. It doesn't discriminate. And the main form of arthritis that affects the spine is mainly two types, or three. Number one is general osteoarthritis, and we may get it in these little joints here. And these little joints are called facet joints, or Z joints. Now, these are the joints that are formed when our vertebrae stack up on top of each other. We've got many vertebrae throughout our spine, so we've got many, many facet joints, okay? So, and then another vertebrae will be sitting up here. So each vertebrae has two connections above it and two connections below it. So osteoarthritis can affect the facet joints. People with rheumatoid arthritis, that autoimmune rheumatic condition, can also affect the spine, namely the neck and the low back, or the cervical and the lumbar. And the last and more specific arthritis that affects the spine is ankylosing spondylitis. So ankylosing spondylitis not only affects these facet joints, so the cartilage in there and the synovial fluid can be affected. Not only does it affect this, similar with rheumatoid arthritis, it also affects the soft tissues that surround the bodies of the vertebrae and the discs. Okay, so these are what we call the body of the vertebrae, these thick platforms in which the vertebrae stack up on each other, and in between them sits a disc. a vertebral disc, intervertebral disc, or like a pillow. And again, very similar function to cartilage, helps to absorb, a bit of a shock absorber, really, okay? And with ankylosing spondylitis and rheumatoid arthritis, the muscles, tendons, and ligaments that sit around here can become affected, inflamed, scar tissued. And with ankylosing spondylitis, in fact, the anterior portions of the of the vertebral body can actually grow and fuse, connect together essentially, which severely limits range of motion. And this is what we want to reduce. Okay, reduce it occurring completely, or certainly reduce its severity. And this is why I say it's important to maintain range of motion. Whatever you've got, keep moving through it. Okay. So any questions on those particular conditions and where they affect and how they affect the joint of the spine? No, all good. Okay. So the next the next thing that we need to talk about is how these joints move. Now, each section of the spine has different degrees of movement and in various directions as well. Okay. We're not going to go into them too much, but essentially our spine can move forward and backwards. Okay. So that's this guy here. So we're moving to the front or forward is often flexion. So we can flex through the lumbar spine, through the thoracic, the middle spine, and we can flex through the neck like so. Okay. We can obviously do the opposite of that. So extension. So from this flex position here, we can extend. This person is mainly flexing at the hip, but we can get extension through the lumbar spine mostly, a little bit through the thoracic, and a lot through the neck, like so, okay? Ideally, when we flex forward, we can use our hips and we can obviously use our spine, and the spine kind of goes into a sort of a C shape, if you will. We should be able to get close to touching our toes. I'd be curious to know how many people can bend over to touch their toes. You have to have hip mobility, but you also need to have mobility in your spine. We can do some side flexion as well. So this is that middle bit here. This is that middle picture here. So side flexion, okay? So going from side to side, if you had your hands and you had them next to your thighs, to side flex, I would ask you to keep looking forward and don't rotate your torso, but slide your arm or your palm down to your knee, okay? And that would be side flexion. And that is, again, an accumulation of small movements throughout each of the segments of our spine. Lastly, we have rotation, okay? So you can, from a seated position, to limit movement of your hips, you can rotate in your chair like so. And again, we get different degrees of rotation from different sections of our spine, but we're looking at, I guess, the cumulative effect of all of the moving parts. So we have flexion, extension, side flexion, left and right, and we have rotation, okay? So all of those movements come from these facet joints, okay? And what allows these movements is the lengthening and contracting of contractile tissues, being our muscles that sit either side of the spine, okay, that sit in front of and behind the spine. So again, really important elements to movement, but of which arthritis can affect. Okay, so let's have a look at some of the muscles that may be surrounding the spine. Now, I won't go into them in much detail. I'm just going to refer to them as large groups, okay? Number one, the muscles that run either side of your spine that keep you erect are called the erector spinae group, okay? There are muscles that sit closest to the spine, and then there are muscles that sit further away from the spine. Some have attachments right down here in the sacrum and the ilium, and some have attachments through the spinous processes of the vertebrae all the way up to the base of the skull. You can even see here, we've got some attachments to ribs, okay? So these obviously provide us with our posture, okay? Keeping us erect, essentially. And these are the muscles that will help us into extension. On the other side, on the complete, or sorry, should I say, these muscles here are somewhat deep, if you will. We have some other muscles that sit superior or superficial to those. So you might know of the trapezium, the trap muscle, trapezius. Who's ever gone, oh, my neck's sore, and they've done like this here, neck and shoulder is sore. So that big muscle here that you feel on your shoulder is your trapezius muscle. And that helps to move our neck. And our neck, of course, is part of our spine. Latissimus dorsi actually does a lot of movement of the arm instead of the back, but can certainly help and contribute. And then we've got a lot of muscles here of the shoulder, but we'll speak about those soon. On the flip side, so that's the back, this is the front. And while this doesn't attach to the spine, it certainly helps to keep us erect, to stabilize through movement, okay, and to help us flex forward. And this would be our abdominals. So believe it or not, you all have a six-pack, believe it or not. It will just depend on how much adipose tissue you are carrying around that midsection. But there are four, if you will, layers or muscle or groups or muscle groups that create the abdominals. We have the most external, or should I say superficial, the rectus abdominis, okay, to all the way to our transverse abdominis, the most deep muscle, okay? So these, again, as I mentioned, they help counteract and balance the muscles at the back. So they work together with each other in flexion and extension. Much like we have the abdominals at the front of our body that work in opposition to the erectus spinae, we have similar up the top in our neck. So we have some deep neck core muscles, and there are some exercises that we're going to target that target those particular muscles that sit here at the front, okay? Okay, so let's have a look at some mobility. This is general mobility, and like I said, the neck and the spine can both flex, extend, and rotate and side bend, okay? So this is for anybody with or without arthritis. This is if you're just generally feeling stiff, and this is all the way through to having and experiencing the condition, which is arthritis. Sometimes people may not necessarily have that, but certainly feel stiff and really, really sore when they wake up in the morning. Has anybody experienced that? They might have slept a bit funny on the pillow and then had a lot of pain and couldn't quite turn a certain way. This is called wry neck or acute torticollis. You may have known this condition occurs congenitally when babies are born. Their sternocleidomastoid muscle here actually is shortened, and if it's shortened, they kind of turn to the side. This isn't that, and if you didn't have that and you're just waking up in the morning, this isn't that, of course, but instead this comes from the disc or the facet joint in the back of the neck here. So these mobility exercises can be used for lots of different reasons, not just for arthritis. So that's good to know. So you could be doing a lot of work sitting at a desk like me. So sometimes I just take a moment out. I don't necessarily have arthritis of the spine or of the neck, but these definitely help me. So with flexion and extension, it's just as simple as that. We're going to drop our chin to our chest as much as we can, or as far as we can. So what you want to do is feel sort of a stretch in the back of the neck. You may even feel a stretch occurring down the mid part of your back, so between your shoulder blades. That's okay as well. And what you want to try and think of doing is pulling this part of your neck to the back of the room. So if you push down like this, try to push backwards through the spine, if that makes sense. So you really want to try and create a nice curve. We really want to be opening up those facet joints as much as we can. To do the opposite is we're going to look up as far as we can. Okay. And again, you might feel a nice stretch occurring at the front part of your neck. Okay. If you were getting a pinching sensation as you are tilting your neck back, that's okay. What I suggest doing is not pushing past it, but just gently pushing into it. So say you had a sticking point here, and that's as far as your movement could take you, and then you felt a blocking sensation or a painful sensation. That's okay. You don't have to throw your neck back and get it past to there. Just focus on moving into that pain and out of it. Just moving into it and out of it. And the same goes for rotation and side bending. Now, when we rotate, we want to try and get our chin to the mid clavicle. So here's my mid clavicle line. So your clavicle is your collarbone sitting along here. So mid clavicle line, you want to try and get your chin in line here. That's some good or decent range of motion. That's what we want to see, okay? So gentle rotations either side. Now I've got pretty well full range of motion, but for some people that can be a struggle, okay? And when you're driving in a car, that can be difficult, right? Because you want to try and look behind you if you don't have a camera, you don't have a reverse camera. You kind of have to shift the entire body to do so. So if that's you, doing these rotation exercises, flexion, extension, and side bending will hopefully help keep what you have or even improve it further. And last but not least is side bending or side flexion. So keeping your head forward, okay, and straight, like looking ahead, you want to take your ear to your shoulder. And again, you might feel a stretch on the opposite side of your neck, and that's also fine. Sometimes people feel a pinching sensation here. So just like with extension or any other movement where you feel that block or you feel that pinching or very focal pain, again, just gently move in and out of that range. You may find that you might be able to move past and increase the range of motion. However, if there is arthritis, then the possibility of getting past that varies, but depending on the reason why the blockage is, you may actually gain some more range of motion. So there's some neck mobility, and within the PDF on our website in the spine, there is some directions, okay, and parameters around how many times you should do this. So it really depends. You can do it as many times as you can throughout the day, maybe 3 times a day, and you might do 3 sets of 10 to 15 reps. That's very arbitrary. It really just depends on the reason why you're doing it, but I would just do it until you feel more ease, essentially. Okay. Now, if you're having a particularly painful day or a particularly stiff day, sometimes you can do this assisted. And I like to do 2 ways. I get a towel, okay? Put the towel behind your neck, like so. Then you want to swap your hands. You want to pull down on one side to keep it nice and straight, provide a little bit of pull or torque. The other side, the other part of your towel comes across your ear, and I'll just take my glasses off for this, and across your forehead like so, okay? And then you want to gently pull with the arm into that rotation. This may be because you feel like maybe a little bit more stiff a particular day, and using a little bit of outside force other than maybe of your muscles can help you move into that range of motion a little bit easier. Down below is basically the same thing, but you're using your own hand, okay? So what you're going to do is using your hand, you're going to reach behind the back of your neck and pretend that these are my fingers. Very poorly drawn, I know. This thick line is my spine, or it'll be the hard bits that you feel sticking out the back of your neck. They're your spinous processes. So what you don't want to do is go over that midline, okay? You want to grab just, oops, where are we? Just next to them, okay? Just next to them. With your elbow up, you're going to move the elbow in a half or semicircle, while obviously your hand, your fingers, an extension of your elbow, are then gently pulling your neck into rotation. I would suggest doing those if you feel like you've got a sticking point, a blocking point, or it's quite focally painful. This may help, okay? Just a little bit of added overpressure sometimes can help. Never go to extreme, never go till you're in like, you know, an 8 out of 10 type of pain. Okay. Here's some mostly stretch and one strength exercise for your neck. So those core neck muscles, remember the opposite of the erector spinae at the back. Okay. If we've got sore neck, if we've got a stiff neck, if we've got limited range of motion, let's see if we can relieve some stiffness and pain through stretching and also through strengthening. So we've got chin tucks, okay? This can be done in a seated position. This can also be done lying supine on your back while you're in bed, or maybe on a harder surface like a floor with carpet, okay? So basically speaking, your fingers are here just to guide, but what you want to do is tuck your chin into your neck, and you can feel these muscles working. This is what we want to do. So you want to go straight back, not down, straight back. Give yourself a double, triple chin. That's what you want to do, okay? Now, if you were lying down, you might like to pretend that you've got a pillow by putting, or you can have a pillow if you want, but put your hand where your pillow would be at the back of your head or at the back of your neck. And by doing this movement, when you're lying down, you'd be squashing, you'd be feel pressure on your fingertips. And that's what you want to do if you're lying down doing this, okay? Here we have some stretching of the neck muscle. So the side, remember how I was like, oh, sometimes you might get a sore neck or shoulders and you start sort of self-massaging and you feel it might be tender and sore and stiff around this upper trap region. So this particular stretch here stretches those exact muscles. What you want to do is take your chin down to your shoulder. So as if you were going to smell your armpit, basically. Okay. And with your hand, reach up to the slightly back behind your ear. Now sniff under your shoulder. You're going to use your hand that's over your head just to slightly pull down into your shoulder. Okay. To further the stretch, use your other hand like you can see in the picture. Take that behind your back, or you sit on it, okay? That drops the shoulder even more, okay? And that increases the sensation of the stretch. Now, there's lots of literature and debate about how long you should be holding stretches. And again, I don't even know if there has ever been made a, an actual seconds, I don't know, 10 seconds, 12 seconds, 15, it doesn't matter. Hold it until it makes you feel better. Okay, just move. What I would suggest is move gently in and out of these movements. Okay, now to stretch the front part of your neck. Okay, what you're going to do, say I'm going to stretch the right side of my neck. Okay, I'm going to take my left hand and gently pop it just on top of my clavicle, and then my right hand over the top of that. That's going to gently push down and hold, okay, while I lift my chin diagonally up and I extend like so. Keep your mouth together, like you don't have to clench, but keep your teeth together, okay? And you should start to feel a stretch at the front side of your neck. Okay? And sometimes you don't even need to hold yourself. Sometimes just doing that movement there provides enough of the stretch. So using these stretches, this chin tuck, and the range of motion movements in conjunction with each other, spread throughout the day, on the days that you might be sedentary, like working at a computer, for example, or, you know, having driven and commuting for long periods of time, can really help to maintain range of motion, reduce stiffness, and potentially manage pain. Okay, so now we're looking at thoracic spine. Now this one, only one of them I've got up here that requires a foam roller, but we can use and substitute that piece of equipment with a towel. So a few of these obviously require you getting down to the floor. So if that's what you need to do so carefully, please. Now, remembering that our spine does flexion, so forward bending, back bending, it does side bending, and it does rotation, okay? I've done a fair bit of focus here. Oh, no, I've done two exercises here that focus on rotation. So the first one here is where quadruped. So we're down on all fours, okay? And knees and arms sort of create that bit of a, you know, box, if you will, box with the floor. What you need to do is place your hand behind your head with your chest parallel to the floor. And what you're going to do, as you can see in this picture here, is open up to one side, okay? If the hand behind the head doesn't work, you can take your hand across your shoulder in front of your chest, like in front of your chest on your shoulder instead, and you can still do the rotation, okay? While you're still down on the floor, you can do what's called an open book, or this open book exercise. This is fantastic for going through that rotation range of motion. So what you want to do is be lying on your side. You want to stack your arms, stack your hips, your knees, and your ankles. If that's uncomfortable for you, not a problem. You can place a pillow underneath the knees here if that helps. Moving this leg in any other direction, like if it were to sit up here a little bit more or sit a little bit more straighter, that's okay. It may limit slightly the range of motion in the lumbar spine. But this mainly focuses on pushing into rotation for the thoracic spine. I mean, that's its main focus. We still got rotation throughout the whole thing, throughout the whole spine. So from this position here, all you're going to do is open your arm up. And you're going to try and touch the back of your palm on the floor behind you. Make sure you follow your arm with your head, okay? Your neck's going to rotate with you as well. Now, you may not be able to get to the floor. That's fine. Go as far as you feel comfortable. Go to where you feel a block or a stop. Go to where you feel pain, and then come back to the start position. And then you can just gently move in and out of that movement. Now, if doing rotation on the floor isn't for you, or you need to work up for that, you can do some movements in a chair, okay? So that's a fairly simple way to do rotation, using the back of the chair and your arm to create a bit of torque to move you into that rotation, okay? So say I'm going to rotate to my left. I'm going to take my right hand, pop it on my left knee, on the outside of my left knee, and I'm going to gently rotate. With my left hand, I can use my low back to help pull me around, or the back of the chair, like you can see in the picture. Now we come to extension and flexion. Again, this can be done using a chair. Please be careful with your chair. Make sure that you're not in a position that it is going to flip back. Please don't do it on a chair with wheels, okay? Best not to. But this chair was the perfect height for me. I could sort of shift my bottom forward or back in the chair and align the straight part of the chair, the back of the chair. I could align that on a part of my thoracic spine, so the mid part of the spine, where I felt a little bit sore and a little bit stiff. Once I lined that up, I then placed my hands behind my back and I gently leant over. And all I did was just moved really slowly in and out of that movement. Now, if you like, you can do exactly the same thing, but on the floor. This time gravity is on you a little bit more because you're lying flat. Gravity is coming down on you this way. So you can get a little bit more movement because you've got the weight there as well, weight and gravity. If you don't have a foam roller, you can use a rolled up towel. So carve it or whatever you want to do. And then you're just going to roll it up. So it just looks like a log, okay? Place that up and down different segments of your thoracic spine, so your mid part of your spine. Lie on top of it and then lean over it and enjoy the stretch feeling and the range of motion that you may get, okay? And again, you just want to move in and out of that nice and gently. Any questions? Okay, some more spine mobility and strength, okay? Here's the cat-cow or cat-camel, or this one has multiple names. Cat-camel. So again, quadruped, we're on our knees, we're on our hands. We want to get some flexion through the spine. See how that's a bit of a C shape, if you will? I get more flexion in my thoracic spine than, say, the lumbar, if you will, okay? So that's where a lot more of the movement's going to be. But what you want to think is that you've got a piece of string pulling you up. And you want to get a nice curvature of the spine. Opposite for when we sink our tummy to the ground. So lifting your head up, sticking your butt out, and getting a nice bend in the spine. Number 2 is what we call a Superman. This is great for the erectus spinae. Okay, so those muscles up and down the spine. And again, also really good to stabilize through our core as well. So those front abdominal muscles and deep abdominal muscles. So here what you want to do is be in this quadruped position again. So on all fours, knees and hand and arms, creating a square or box shape. You want to lift opposite arm, opposite leg. Okay. They don't need to go past parallel to the ground. Like this doesn't need to come further up. This doesn't need to come further up. And then all you need to do is take it out there nice and slowly and balanced, and then bring it back to the ground. Knee to the ground, arm back to the ground. Okay. I would do 10 to 12 reps on either side. Lastly, we've got the cobra holds. Okay, so this is another great strengthening, back strengthening exercise. So lying on your tummy, forehead or head close to the floor, arms next to your ears, bent at the elbow, and all you're going to do is lift your chest off the ground. Okay, you want to hold 1 second, 2 seconds, 5 seconds as you increase your strength, and then lower to the ground. Again, parameters about how many times you might like to do this, how many reps are in the PDF. Okay, are there any questions about those exercises that we've just gone through? No, good. No, all right. I don't think that there's anybody in the chat box right now. Oh, sorry, someone did. Teresa, notice example has crossed legs. Is that important? Let me have a quick look as to which one that may have been. I don't believe it was important. Oh, here. No, If it's this that you're talking about, no, not particularly important. Not at all. That's just me being comfortable. See, I've got them crossed there. I don't have them crossed there. Okay. All right, then I'll just double check anything else. Thanks. Good. Okay, got that one. All right, I'll have a look. I think somebody else sent me one, but I'll have a look at that in a moment. All right. Okay, that was the spine. Now there's a few more exercises within the PDF, but right now we're going to have a look at the shoulder. We're going to have a look at shoulder anatomy, just to make sure that we understand what the shoulder is and what it does and why we need to move it in certain directions. Now, the shoulder is what we call a synovial multi-axial ball and socket joint. What a mouthful. Ball and socket, because it's exactly that. We've got a socket, we've got a ball, it sits in the socket. So in this case, the socket is a little bit shallow, okay? A little bit shallow. And the ball is quite bigger than the socket itself, all right? It's not as stable as the hip ball and socket joint. And because of that, it allows a much greater range of motion, okay? But it needs a whole bunch of stabilizing and muscles and tendons and ligaments. So because it is a multi-axial, it moves on multiple planes. It has a lot of movements or actions that it does. So we've got the typical flexion and extension. So flexion is going forward, remember? And into hyperextension, if you will, past the ear, and then, flexion, and then extension. So from all the way up here, all the way back, and as you can see, past perhaps the torso into a hyperextension. We've also got abduction, adduction. So abduction, so thinking abducted away, is away from the body, up to the ear. And adduction is adding back to the body, okay? Back to the body. We can have rotation in a few different planes, but just easy to show you now. We can have internal rotation, and we can have external rotation, okay? And if we put all of those movements together, we get what you call circumduction, okay? So our shoulder should be able to allow it. Our shoulder anatomy and function allows that range of motion to occur, okay? If it isn't affected by something like arthritis that may have changed the shape of the ball and socket, okay? Which may have disrupted the cartilage, which makes it feel kind of grindy or a little bit stiff and painful, which can reduce our range of motion. The glenohumeral joint is the shoulder joint, but what else helps this joint move? Not necessarily directly, but indirectly, is the acromioclavicular joints, the AC joint. So anybody who has any trouble with that joint out here, sometimes even this joint here of that clavicle, moving the shoulder can actually be painful, okay? Because it doesn't move in isolation, the clavicle moves with it. So you may have experienced that. And some people can get arthritis in the AC joints. That's a little tiny joint as well. It's got a little disc in there. And it certainly is, you certainly can get arthritis there as well. All right, many muscles that make our shoulder move. We mentioned before the trapezius, this big muscle here. It has an upper, a middle, and a lower portion, which help move the scapula, okay? The scapula makes up part of the AC joint. Then we have the deltoid, so the cap of the shoulder. So you all should be able to feel that muscle there. That helps us move into flexion, into extension, and to abduction. We have the tricep brachii. We have bicep brachii at the front, okay? Some of the bicep and tricep actually attach over the glenohumeral joint, meaning that it helps to move the joint itself. Okay, and there are a whole bunch of smaller and accessory muscles like the pectoralis minor, Pec major is a major mover of the muscle, of the joint shoulder itself. And then you may have heard of the shoulder cuff or rotator cuff. Sorry, what are they called? Muscles. And these would be those little muscles here. So they include the infraspinatus, teres minor. We have the supraspinatus as well, and the subscapularis, which sits more so, at the front there. So you may be aware of those because sometimes they can, we can injure them, which makes moving the shoulder a little painful. We can feel a little bit weaker in that area. But if you've got an arthritis that not only affects the joint and the inert tissues like, or the non-contractile tissues like cartilage, these may also be affected too because they sit quite close to that joint or that glenohumeral head. Okay, so to get these muscles moving, to get the joint moving, to reduce stiffness, one of my all-time favorites, and it's such an old school exercise, is called the pendulum swing. I'm going to try and stand up and do this. See if you can see. I'll try and get the light behind me so you can see my silhouette a little bit. If you're even seeing me, you might just be seeing the PowerPoint. But this one here, what you want to do is lean over. I've got my hand on a chair, you can see in that picture, and I'm just letting my arm dangle. Okay. I'm letting gravity do its thing. This is great for somebody who has really quite severe pain, lack of range of motion, potentially because of arthritis, but even for those people who may have experienced or are experiencing a frozen shoulder. Okay, so letting the arm dangle with gravity. You can potentially even hold a small weight. I've got my phone, but like a little dumbbell or a can of soup or something like this. And basically, you're just going to go in circles. Let it get momentum and let the arm swing in circles. You change direction. You can go side to side and forward and back. Okay. So that's a great little exercise to help create some gap, okay, within the joint space to take a little bit of pressure off. Another great way to get some extension, okay, because often extension and flexion, okay, is with a dowel. So we can go into flexion and into extension in this picture here. So using a broom, using a pole, whatever you've got lying around at home, could be an umbrella. I use an umbrella if I don't have my little green sweeper. We want to hold it straight up in front of us, okay, perpendicular to the floor, and we can either go into flexion or into extension, okay? So either way through there. And what's really great is because to move the shoulders, particularly this movement here, we actually need extension of the thoracic spine as well. So this can help us do that as well. This can help us do this. And you don't have to do this lying down. You can even do this with your back up against the wall, like this exercise here. Speaking of this exercise here, we've got some wall angels. Okay, let's move that over there. What you want to do is you want to stand back against the wall. If you can, take your arms out either side of you. You kind of want to touch, you want the back of your elbow to touch the wall behind you. Back of your hand and your arm should also. Starting with the elbows as close as you can to your body, you want to take them up into a slight V. Okay, like so. And keeping this part of your arm and your hand against the wall, you're actually asking your shoulder to do external rotation. So you're getting abduction, adduction, but you're also trying to maintain external rotation while you're doing this. You may not be able to. It might be something that you work up to. You might find that your elbows are coming forward. You might find that your elbows can stay, but you might have to sit your forearms more neutrally or into internal rotation. And that's okay. It might be something that you have to work up to. This is kind of similar to the setup of the prone cobra. But this time we're not lifting our chest and our head off the floor. This time, instead of being against the wall like our wall angels, we're going to actually be lying down. This just changes the difficulty of it when you change your postural positions. This time we're lying on our tummy, lying flat, with our arms in front of us, pinkies on the ground. And what you're going to do is for 1 second or 5 seconds is just gently lift them off the ground. You only want to lift them so much as your arm in line with your ear, like it is here. Okay. And then back down. Try to breathe normally as you do this, because sometimes it can be difficult and we end up holding our breath. Just try to breathe normally. Now, what you can do is try this at different angles. So you've got an I, you've got a Y, and you've got a T. So I is next to you, Y moving out, and T to the side, okay? And then you just want to lift, slightly lift the chest, slightly lift the arms off the floor to do this exercise. There is further instruction in the PDF manual. So again, you're gaining back strength, so strength of the shoulders in the back part at different angles, which is really good because, you know, we don't just walk around in one plane of movement in the day. We're moving our arms and lifting things in all different types of directions and angles and planes of movement. So we need to ensure that we maintain strength in those. Here we have some more strengthening exercises with a TheraBand. Now, a TheraBand is super easy and simple and very cost effective if you don't want to get sort of, you know, dumbbells for home, for example. So here we've got a row, a simple row for the back muscles. So back of the deltoid, back of the rhomboids or rhomboid muscles, and back of the trapezius muscles. So here you want to add a little bit of tension, okay? And with your elbows, straight, you want to slide them past your rib cage. You want to sort of squeeze those shoulder blades back together and release forward. Back together, release forward. Here we've got a standing lateral, that should be lateral raise, not ladder raise. Standing on it, small warning, don't let go of your TheraBand because it will snap you on the feet. But standing on it, okay, and then you want to be lifting your elbows. That can be bent or straight, it's up to you, okay? Having them straighter and doing abduction is a bit harder than having the elbows bent and doing it, okay? Longer lever is harder, okay? So maybe that's something that you work up to. And here we're doing a lateral raise. So we're focusing on the smaller muscles under the deltoid, but also the deltoid as well. Now, some people feel kind of stiff in the shoulder, and this sleeper stretch is really, really good to stretch the posterior portion and capsule of the shoulder. So if you've got a condition that affects the actual like bone cartilage capsule itself, like arthritis, the sleeper stretch might be good for you. So you see how I'm lying on my side? My arm is straight out in front of me with my elbow bent, okay? My other arm is going to guide my hand down to the table, okay? Creating internal rotation. And again, like I said, this stretches the posterior part of the shoulder. This is a stretch. So you can hold this for as long as you feel comfortable or for as long as it feels better. Okay. That sort of led me to the end here. And if you didn't know about Get Moving Plus or the series, it is on our website. And just to get a bit of an idea here, before we leave, I'm just going to pop this poll up. Other than right now, who knew about the Get Moving Plus, or who has looked at it before? And other than now, because now you have seen it. And then the second question is, who uses the Get Moving Plus resource already? So have a little read of those and answer. If you want to stay on for another few minutes, I will share the screen and show you where it is on our website. If you don't have any other questions that you'd like to ask, then you're obviously welcome to leave. So thank you so much for coming. Thank you for participating. You're welcome. This was just to take you through and show you what is available on our website. Okay, that's good to know. So a few people do, a few people don't, some knew, most didn't. Okay, that's great. Does anybody have any questions before they go that they'd like to ask? Thank you, that was helpful.
Kat,
yes.
The exercises on all fours and the quads down on the floor,
Yes.
Can you do some of those on a firm bed?
Firm, it would have to be firm. My issue with being firm, my issue on a bed is, yes, being on your knees is probably okay, but then being on a bed that, and you said it was firm, but if it was soft, putting weight on your wrist, that can cause a bit of stress on the wrist, and that can be a bit painful. The other thing it does is, if you don't have very good stability or balance, that can cause an issue. But I guess you're on a bed, so if you do fall, you're on a bed, but make sure you roll and fall to the side that most of the bed's on and not off. Look, you can, it might be a little bit more difficult, but if it's a nice firm bed, then I think give it a crack. And you're right, some of the exercises, some have written here that they can't get down on their all fours for many reasons. Some are maybe waiting on a replacement. Don't do that, that's fine. Don't do the all four exercises. Do the ones where you're standing or seated. Do the ones where you're lying on your back or on your tummy instead, okay? That way you're taking the element of weight bearing out of it, okay? That's why I've included a few different postural positions, and not all of them. There are more exercise examples on the PDFs on our website.
Right, thank you.
That's okay. Thank you, thank you, thank you.
Kat. Kat, I have 2 hip replacements and 2 forefoot reconstructions, so getting up and down off the floor is a bit of a joke.
Yes, I can imagine.
I also have spondylitis in the upper lumbar and osteoporosis in my spine. So are any of these exercises going to do any harm? Pretty brutal.
Yeah, for you, look, you've got a lot of things going on there with the 2 replacements and the osteoporosis and the spondylitis of the spine. So for you, you really want to make sure that you are maintaining range of motion, but for you, it's about how you do it. So at the moment, it's probably best not to be getting up and down from the floor, although that's something that you might be getting working up to. I'm not sure if you're working with a physio or EP. But for example, I'll just show you, for example, say you wanted to make sure that you were still getting some rotation in the spine as best you could, okay? So these aren't the exercises for you, are they? Not really.
No.
No, we can't do. I'm sure you do get in and out of bed though, is that right? Yes. So you can do this one in bed. That's okay. You don't have to be on the floor.
Okay. Yep.
That's fine. So long as it's not one of those beds that when you sit in it, you sink all the way.
No.
Yeah.
No,
Okay.
it's a firm bed.
Good. So you can do this on a firm bed. Sure, it's not, sure you might be your spine might be a little bit, up and down because that's fine. Don't worry about that. You're still getting some rotation. That's fine.
Okay.
And remember, you can do all of these movements from a seated position. So that's fine as well.
Okay.
So for you, it's about reducing risk of fall or further injury from getting up and down off the floor. But also from a weight bearing perspective with the types of arthritis that you have. Annoyingly, you've got osteoporosis, and weight bearing training is the best way to manage and strengthen your bones.
Okay.
So for you, it's kind of very difficult. You're going to have to make some a pro and con list and work with safest exercises. And once you've built strength and confidence around those exercises, it's about building in the type that you do in terms of weight bearing.
Right. Well, I do at least 30 minutes a day walking the dog.
Yeah, that's great.
And I also do a bit of pool walking.
Wonderful.
In the heated pool.
That's great. So you're doing some weight bearing things like walking and non-weight bearing things like pool. They're all fantastic. When you're feeling confident, feeling not as sore or depending on how, I don't know your situation, but I would suggest starting to look at increasing the intensity of those things. Maybe you'd like to include a little bit of a hill. Maybe you'd like to include some stair walking as well. Okay.
Okay. Terrific. Thank you, Kate. Kat.
That's all right. You're welcome. Anybody
you.
else got any questions there? Or are you happy or just sort of listening?
Very good. Thank you.
Okay. No problem. Great. Okay. I was just going to quickly show you, if you were still on and you wanted to stay, you can. I was just going to share screen. If you weren't aware of where it was on the website, although I've just got it up, although I've got it on the wrong thing. So excuse me a minute. Just give it a minute. It's just all right. Wendy, can you give me a thumbs up if you can see Get Moving Plus exercise series on the screen? You can. Fantastic. So this is our website. You go to, you type Arthritis New South Wales. I like to just use this little search bar here, though you might be able to find them on the side here to the left. I just type in the Get Moving or Get Moving Plus. There's me. I'm going to talk to you about something. If you want to watch that, you don't have to. What's really great about the Get Moving Plus programs or exercises are that they're both industry endorsed. One from Aaron Wood, who's a physiotherapist and coordinator of the Osteoarthritis Chronic Care Program at Canterbury Hospital. He endorsed the lower limb exercises. And then we have the lovely Stacey, and she is a hand therapist, physiotherapist, senior clinician at the Royal North Shore Hospital. She endorsed the hand part of our Get Moving Plus exercises, which I'll go into next week. But so you can read a little bit about that. If you keep scrolling down, the booklets are here, joint by joint. So this is the hip joint. If I select this, it should open. Okay. If you want to have a look at the booklet, you select the booklet over here, the actual booklet, click on it, it'll download, or you can click on the hyperlink here. And then here are the videos, okay? So all of the exercises that are covered in the booklet, you should be able to find here. And sometimes people like verbally, they like a written instruction. Sometimes they like to see it done, okay? So that's where we are for that. Okay. Just a few minutes past there, and I'll probably have to leave it there. So I hope that was interesting or insightful. I hope that maybe if you didn't know about the resource, you do now, and I hope that it can be somewhat helpful to you. I would always suggest, depending on your situation, taking those exercises to a physiotherapist or exercise physiologist. Maybe you're already seeing someone now and saying, you know, what exercises out of this booklet can I do from home? Because they're great exercises to do from home. They're fairly benign, but sometimes for complex cases and with comorbidities, you might have to make some more considered choices. Okay, all right, that's it. Let's wrap it up there, gang. I hope you have a good day. Perhaps might see some of you tonight at the 7:30 webinar. This webinar is recorded. It will be online by the end of this week, on our website, sorry, by the end of this week. Okay.
Thank you very much, Kat.
Thank you. See you later. Have a good day. Bye-bye.
Bye.